Oh my gosh. Look who it is. Our all-time favorite, the GOAT, Dr. Aaron Carroll, joining me, and we're live for people watching live, and people will start coming in soon. Hi.
I didn't even know you could do live. That's amazing.
I just started, so it's just been like a month, and most people are fine to go live, and technically it's been miraculous that we can do this, so I'm glad to see you.
I mean, technology is amazing.
It is.
What will they think of next?
Well, you know, you've always been big bullish on tech. You're a fast adapter. Even as you age, you don't seem to slow down. The kids aren't passing you by. But since you mentioned it, since you said technology is great, I've been wanting to ask you this for a while. On a scale from 1 to 10 on AI, how afraid are you of an extinction event?
I'm not very afraid.
Oh, good.
Yeah, there's a lot of steps to get there, and
okay.
A lot of things that could stop it. So I'm not. That's not what the biggest worry on my plate. It's not even close.
Great. I'm glad to. So when it comes to AI, you're not so concerned about what it's going to do to actually kill people.
Not yet. No.
Okay. And have you dug into all the debates? There's all these. I can't.
Yeah.
Okay. I figured you had, because you're also like, I think not only are you a brilliant scientist and doctor and researcher, but you're also a total sci-fi nerd. I think that matters because you've read about some of the dystopian or some of the future potentials with AI, and so you can take that and look at the reality of it. Am I right about that? Like
I don't know if it makes me like more accurate, but it's like, I mean, I guess I've thought about it, but there's so many different things that could go wrong in so many different ways. That's not top of my list.
Well, I'm happy to see you to talk about healthcare and health policy. It's funny in the chat.
I'm much more concerned about that.
In the chat, one of our friends says, "Hello, dental flossers of the Stand Up with Pete Dominic community, unite."
I'm never going to let that one down.
Never forget. Hashtag never forget.
No.
I do want to talk about some health-related concerns, things, and obviously health policy. But real quick, I'm 50 now, as you know. What do I need to know? Anything?
I mean, I found that I've gotten more tired. My near vision has gotten worse. Things don't heal as fast as they used to.
Mm-hmm.
But, otherwise everything's great.
And
I'm a few years past you. So, it's all fine.
And also got to get this out of the way. Nobody else has told you that you remind them of Zohran Mamdani.
You keep saying this. I have not been told that by a single person other than you.
Not only do you look like him, which I think is a compliment, he's considered a handsome man, but you
young too. So it's like that. I guess that's a compliment, because I look at me on the screen and I'm like, that guy looks old and tired.
You also share mannerisms, or he shares mannerisms with you. Yeah, because one thing that he does that you do is when you're listening or even debating, I've seen you more than anybody. You have a smile. You keep a smile on your face. You keep this pleasant energy throughout a contentious conversation. And sometimes I'll say, maybe it's only me that sees this. Sometimes I feel like I see a glimmer or a glint that you're excited to give the answer because you got a really good answer coming up. So it's kind of twofold. Am I right?
Sometimes. Also, it's just like what there's no point in getting angry. It's like it's just easier to have a better conversation without going that way.
Yeah. That's where we disagree, of course.
I know that. It's so funny. Recently, somebody said to me, have you ever met Pete's dad? I'm like, he's yelled at me on the radio. And then they're like, have you met his brother? I'm like, he's yelled at me on the radio. It's like, I think everyone in Pete's family has at one point or another yelled at me on the radio. So it's like,
not my mom, I don't think.
No, not your mom. To your credit, not your mom.
You think leading with anger is never good?
It rarely accomplishes what you would like. I mean, it's like if your goal is to try to change behavior or influence people's decision or get them to think differently, anger rarely works.
Do you think that's the primary reason I'm so alone? All right, moving on.
No, there's so many.
I knew when I said it.
You walked right into that. I'm like, please.
Locked and loaded. It could be your face. Yeah. I don't know why I'm writing them now.
Another reason if we're going to,
All right. So, I mean, we talked health policy and health insurance for years.
I can't believe we're still doing it. It's amazing.
And it's become primary in the conversation because of the shutdown and what the negotiation was supposedly about. I think most listeners and viewers right now probably have been paying pretty close attention either to health insurance, the conversation around it for years, or what's recently happened. So I want to ask you a kind of broader question about, from what we've been told by Democrats in terms of the subsidies, from what the rebuttals have been from Republicans in terms of pundits and so on, like from what we've heard from Kaiser Family Foundation and others about premiums and the subsidy that was passed after COVID, has that conversation been represented well, do you think, by the honest, good faith parties? No.
I mean, it never will. Like, it is amazing because we are still literally fighting about an incredibly small percentage of people in the United States and how they get their health insurance. So at this point, we're now arguing about people who receive premiums on the exchanges and how much they will be, without ever addressing the root cause of the problem or what affects the vast
people
majority.
Who receive, I'm sorry, you said people who receive premiums. I think you meant subsidies on the exchanges.
I'm sorry, subsidies for their premiums on the exchanges,
right?
Which is, not not a small number of Americans, but like, we're talking about 15% of America. I mean, I'm not even sure what the actual number is, but like, we're still having the same arguments that like we had way back when, without ever addressing any of the root cause problems that really affect.
I'm hearing you say what I'm hearing then is that we're talking about a small percentage of Americans who are insured, who get their insurance on the individual market, which
right.
was
and are getting like premiums that that necessarily cover them. Which again, I'm not minimizing the problem. It's real. People are going to see their premiums go up significantly because of the end of these subsidies. It's just that this is the same argument we were having in like 2009. Like it's still like, how do we cover those who don't get Medicare? Well, we're not focusing on Medicaid at the moment, but Medicaid or the VA or through their job, and then have to go to the exchanges and are getting premiums, and how much those premiums should be. Like that is like literally the argument that we were having. That was the Affordable Care Act back in 2009.
Okay, when we talk about healthcare, we learned from you it's a three-legged stool: access, cost, and quality.
Sure.
And arguably, not much has been done to bring down the cost of health insurance. And as a result, you're talking about a small percentage of people who get their insurance on the exchanges, individual market, but aren't premiums always going up for everybody, no matter where they?
See, that's just the problem. We're always focused on how do we bring down the cost of insurance. The problem is the cost of care. The cost of insurance is pegged to the cost of care. If we only ever address insurance without ever focusing on actually delivery and care, there is no magic solution. Like it has to be covered. If you add up the total cost of healthcare in the United States, it has to be somehow divided amongst everyone in terms of insurance. Some of that's going to be paid by government, some of that's going to be paid by jobs, some of that's going to be paid by individuals, although that's really all individuals. It's just math. And you divide it out. If the cost of care keeps going up, there is no magic that you can pull that'll all of a sudden make insurance cheaper. Everyone keeps looking for it. It doesn't exist. We have to, at some point, if we want to, address the actual cost of care.
Okay, so that being said, some people might think, well, even if the cost of care stayed the same, insurance companies are always raising their rates anyway. They're always trying to nickel and dime us no matter what. The insurance company, they're denying our claims to make more money. The insurance companies, it sounds almost like you're saying, don't blame them for raising their insurance when the cost of care is going up.
Everyone is to blame. No one is blameless. Insurance companies carry their share of the blame for a variety of reasons. But like the cost of Medicare is going up every year. The cost of Medicaid goes up every year. The cost of your insurance and jobs, which is often just paid for by your large corporation, it goes up. Like it's all going up. It's like you could have everyone on Medicare. It would still go up massively. We could shift everyone to Medicare. It will still be the most expensive healthcare system in the world with no end in sight because it's how much care costs. It's the prices. And all we ever do is try to find fancy ways to shield people from that truth through a variety of mechanisms. And it won't ever work.
Got it. Got it. And we can talk about what will work and what won't and what the status quo is. But just to be clear one more time, talk about the individual market going up, those who get their insurance on the exchanges. But what about those who get their insurance traditionally that are salaried employees through their employer, et cetera? Will those premiums be going up?
Absolutely, massively. Like across the country, care now has started to go up. The cost of care, like for a while, it had plateaued for a bit. Now it's going up again. So nationally, we are seeing across the board significant increases in health insurance premiums. But that's not because insurance companies have collectively gotten together and tried to screw us. It's because the cost of care is going up. And even if you're a nonprofit, small insurance collective trying to do your best, you can't possibly not raise your rates. The reason it's really affecting people in the exchanges is because they have had the benefit of increased subsidies or more taxpayer dollars going to hide that cost from them, and now those are going away. And so they're going to see a shock while everyone else is seeing just a significant increase, but no one's seeing a decrease.
Okay. Really important point there. And just real quick on, there's no magic bullet or button in terms of insurance. Well, why not Medicare for all? Wouldn't that create more negotiating power for all of the cost of care?
How's Medicare doing these days? I mean, if we turn to Medicare, its expenses and its costs are also going up, and everyone inside the Medicare system is freaking out about how quickly healthcare costs are going up in that system. It's the cost of care. Medicare beneficiaries tend to be some of the most expensive people to cover, so that cost is going up too. Sure, you don't have as much bells and whistles and overhead perhaps with Medicare, but it is not immune from the rising cost of healthcare.
No matter what you're drinking, if you're watching live, if Aaron says cost of care again, you have to drink, because clearly that's the point. And so let me just ask you one, I think this is the best possible question right here. Is the cost of healthcare going up in Canada and the rest of the world?
Yes, but not as much. Not as quickly.
That's a good question, because
it is. It is like, I mean, look, again, the cost of care goes up everywhere. The problem is that the cost of care in the United States is so much more than everywhere else that even if we all go up by a similar percentage or even a smaller percentage, the actual dollar amount that keeps hitting us is so massive. And we will not make changes to the delivery system or the things that might matter to reduce the actual cost of care, and almost every other country will.
Okay, well, let's get into it. Is it an hour-long conversation, a 10-hour-long conversation to talk about the cost of care?
No, we can. I mean, we can do that. I mean, we won't get to the end. I mean, I won't. We won't hit everything. But sure, go ahead.
All right, but before we get to it, I got to just ask you one more question that's very relevant right now, and I want to share with folks everywhere, which is you don't have to be cynical to make fun of Republicans' fake proposals to replace Obamacare. It just never comes. They talk about, by the way, they often, when they're asked about it, they say, we don't want to play our hand. Aaron, would there be any reason not to play your hand when it comes to a policy proposal for insurance or healthcare?
No, if for no other reason, then there is no magical solution. Right. Sure. So it's like there is no secret magical solution. If there was a way to reduce costs and improve access and improve quality at the same time, everyone would do it, including the United States of America. Like, no one is against that. Nobody. It doesn't exist. And so we keep looking for a magical solution that absolutely does not exist. Every proposal will have trade-offs, and accepting those trade-offs and debating them honestly is the only way to move forward. We never do that.
It's such an important point, not only with health policy, but everything else. But we don't do trade-offs. We don't even understand what that means. You just can't have everything that you want.
Yeah.
And that's why, by the way, you're not happy.
No, so, I'm like most unhappy about our healthcare, because what plagues the rest of the world is they don't want to spend enough. Like the solutions are there, but they would cost money. Like, you need to improve your quality, you probably need to spend a bit more money. You need to improve your access, you could do that by spending more money. We've already done it. We spend so much money, like astronomical amounts of money, and we don't get it. And so that's where it's like, why it's so frustrating. Like, we've done what almost every other country lacks the political will to do, but without seeing really the benefits of what that should accomplish. And so we're wasting the money.
So all that being said, the president has said for a couple days now what he would like to do vis-a-vis healthcare. It's very limited, but I'm just going to read it to you.
Sure.
He said several times, but the most, I guess this is the most nuanced version of it at least. He says, I'm recommending to Senate Republicans that the hundreds of billions of dollars currently being sent to money-sucking insurance companies in order to save the bad healthcare provided by Obamacare be sent directly to the people that they can purchase their own much better healthcare and have money left over. In other words, take from the big bad insurance companies, give to the people, and terminate per dollar spent the worst healthcare anywhere in the world, Obamacare.
Okay, so you have to get used to the fact that insurance at some level is a, I don't want to say socialism, but the idea of insurance is everybody pushes their money in a pile, and the people that need it get it. And they give it to help. Like, that's how auto insurance works. We pool all our money together. The people that have the accidents get their cars fixed. Fire insurance, people push all their money together. Whoever has the fire gets it. With health insurance, we're theoretically pushing all our money into a pile, and it's going to where it needs to go. If you give everyone just cash, then they can only spend that cash. And the amount that each person gets is not going to be enough if they truly get sick. If we give every American, I'm making up a number, 10 grand, and then they get cancer, well, where does the 100 grand come from? And then if people are like, oh, they should have bought insurance. Well, okay, then we're back where we started from. Whether we give it to you to buy insurance or whether we give it to insurance is whether we do it collectively or individually. And as soon as we start doing it individually, what happens is healthy people make out like bandits and sick people get screwed. That's the system that we had before, where you couldn't buy insurance in the individual market unless you were perfectly healthy and young, because it's not in an insurance company's financial interest to sell someone who might be sick or already have a disease to get insurance. So we have to create this complicated system, if you're going to go that route, where we have community ratings, and which is what every country that does private insurance does.
Community ratings, which rate the health of a
person. You don't get your insurance costs the same as everybody else's, and we don't look at you and say your insurance is going to cost X and your insurance. We just rate everyone the same. That's just like there are only so many options available. There is no example of where it works, especially in the most expensive healthcare system in the world, where you give people money and say, go free market it. It just doesn't exist. Even, your most private systems paid for, like Singapore, don't operate that way. They might for general practitioner, for cheap care, but hospital care, people buy insurance and they actually mostly get their care delivered in public institutions, because that's where the savings is, and the delivery side, not on the insurance side. But we fixate so laser focused only on ever talking about insurance without ever talking about, again, the root causes of why does care cost so much in the United States.
All right. Great answer. Brings up a lot of other questions, but I really do want to get to this question about why our care is the most expensive in the world. Let's talk about the drivers of the cost of care. And there is a plethora, a myriad of reasons that our care is the most expensive in the world. Where do you want to start? How do you talk about this with people that don't?
At the end of the day, it's the prices. It's that we charge more for everything in the United States of America. And why? Sort of because we can, and sort of because we have an incredibly non-functional market that we refuse to regulate in the ways that we could. And because of a bunch of factors that drive in completely different areas, there really is no lever to pull in the system that we have built to drive down prices.
Are we mostly talking about two categories of costs? And that would be, one would be drugs, devices, et cetera. The other would be treatment itself.
All of it, everything. I once did probably the most red blog series I did back in like 2010, back at the Incidental Economist, when we were doing this Affordable Care Act style, like was on why does care cost so much in the United States? It's because everything costs more. Doctors cost more, nurses cost more, like hospitals cost more, drugs cost more, devices cost more, care costs more, staying overnight in the hospital, everything costs more. It is the prices. And until we are willing to grapple with all of it and shrink it down, there is no way to hide it with an insurance scheme where sick people won't get screwed or everyone feels it.
Is that post at the Incidental Economist still?
Oh, yeah, absolutely. I mean, the numbers are probably dated because, of course, it was 2010, but the theories behind it are probably still pretty sound.
So if you were advising policymakers, and how much do you as your role at Academy Health now, what would you tell all of them, not just Democrats, but everybody about, in this case, where to start to bring down the cost of care? I'm not even talking about insurance coverage.
So it depends like how far you're willing to go. I mean, truly, like if we wanted to, I think the secret sauce that we don't talk about, and this again, you're getting Aaron Carroll's opinion, because I think we would need to have a debate and people would need to poke holes in what I'm saying. But what separates us from the rest of the world, what differentiates us, is not how we pay for care, because there's a ton of insurance schemes out there. We always fixate on Canada. I don't know why, because it's arguably one of the few healthcare systems that's not probably much, much better than ours. It might be more equitable and fair, but I don't know that the outcomes are better than ours necessarily. But we fixate on that, what is mostly a single payer system. But there's more government run, like England or the UK, which is, really socialized medicine. Of course, there's private insurance schemes like Switzerland. There's, private insurance schemes in Germany and the Netherlands, or there's public-private, sometimes it's public, sometimes it's private. Singapore is an interesting model where it's like very, very, very private, spending, but they really do catastrophic care with insurance. It's like, it's not the insurance schemes because they're all over the map, but almost every other country, the vast majority of people get their care in a public healthcare delivery system, public hospitals. That's where they go for their expensive care. And the public hospitals run cheaper than we would ever tolerate. Now, a lot of them also have private hospitals, which you can opt in if you like, but the vast majority of people don't. Most people in all of these countries choose the public system. Is it tiered? Yes. Are there differences in what you're going to offer? Yes. Most people opt for cheap, much cheaper care that's good enough in all of those healthcare systems. We don't really have that in the United States. Everyone wants gold-plated. Everyone gets gold-plated. We might have nonprofit hospitals, but they're still incredibly private and expensive. And they deliver in many ways more than what most people do need. We would have to just start really focusing on a radical redesign of our delivery system, I think, if we wanted to truly come to grips with the fact that we could provide cheaper care. We just seem to be it's very ironic because we think we're the capitalists, but everybody in the United States wants the same exact gold-plated care. In many other countries, they explicitly tier it, and you can make choices, and most people choose cheap.
Most people choose cheap. Insurance.
No, care, delivery, care, hospital. In other words, you can choose between these two hospital systems, the public system or that gold-plated private system over there. Now, often you have to buy different insurance products to access them or come up with the cash on your own. But that's the difference. Not what we argue about all the time. Not like, could we if we go to single payer, we will still have the most expensive healthcare delivery system in the world, not the United States, the world. And so that doesn't fix it. It's not. Now, some people argue if we create that public, let's say we got everybody on some kind of public insurance scheme, that then we would use that political muscle to force our private delivery system to lower its prices universally. Yeah, okay. I haven't even seen the political will to change our public insurance system, let alone think that somehow all of it, we can't even do that with Medicare or with Medicaid. So the idea all of a sudden that we're going to do it writ large, no.
I thought you might say, and I don't know what you think about this, obviously, but that one of the big issues with reform of any type, specifically healthcare reform, are issues around campaign finance and how much special interest contributes. So whether it be doctors, hospitals, pharmaceuticals, it affects the way that a policymaker is going to be able to, let's say, find courage to stand up against any one of those. There's a lot of trade-offs.
It's so much worse than that. It's not, it's like, because you're envisioning there's a big bad group of people who are like making money off this whole system. Remember, we're talking like 18% of our economy. That's healthcare. That is what, 1 out of every $6 spent in the United States is on healthcare. You don't need a political action group. If 1 out of 6 people are going to be massively affected by changes that you make, or like 1/6 of the economy, it has its own weight. Like if you start telling 1/6 of the economy, you're going to make less money because we're going to find a way to drive the prices down, they're going to flip out. I don't need a super PAC to get in the way of that. We have built ourselves into a corner where without real leadership and a sense of shared sacrifice and a real political will to grapple with the very difficult beast that we have built, it's not going to get fixed. And everyone keeps looking again for a magic Band-Aid. It doesn't exist.
A sense of shared sacrifice is never going to happen in this country. And I'm a pretty optimistic guy, but in our lifetime, there's never been a shared sacrifice.
Yeah, I disagree with you. I think like I saw evidence during the pandemic where, granted, if you want to look at like,
what evidence
might get very difficult at a federal level. Yeah, it's very hard to like organize a country around a sense of shared sacrifice. Now you can do it. Lord knows we've come together after 9/11. We've come together, I think, at other points where I could say like people really came together. I don't share your pessimism in that. I think in this moment, it's incredibly hard. Around healthcare, it's incredibly hard, which is why we may need to rely on, more local changes or, states trying to do things differently. But if someone truly wanted to try to grapple with this problem, it would mean really rolling up your sleeves and getting together with everyone else to fix it. And that we don't do that. We tinker and we like say, oh, quick fix, put it over there, like a magic solution that we're going to come up with this week, and all of a sudden like, why wouldn't you have done that already? Like if you could do this, do it.
Let's schedule time. I think I can make a good case, and I miss arguing with you. I rarely can or would I ever, and I don't think I've ever like made a real inroads. But on the issue of shared sacrifice, I lived in New York in 9/11. I saw no shared sacrifice, and the COVID epidemic divided us permanently. And it
divided us like as a people. Country. Yeah, go on.
Some people were in solidarity in New York City, staying and not working, but there was always plenty of people that we weren't all together. But we don't have to talk about that now because I want to because I think again, it's like you're looking too big. Like this is where the framers had a good idea. Like there is a point that a lot of government should be done locally. And a lot of stuff should be done locally. And then we can have a federal government for what the federal government should do. But for some reason, we think somehow during a massive like that all of a sudden, like we should all immediately be run by one small group of people that live in Washington, D.C. I would argue my job was like helping to run Indiana University's pandemic response. We had about, 110,000 constituents. It's a medium-sized town. I can wrap my arms around that. We could do shared sacrifice. We could do constant communication. I could, run around with other people. We could make sure everyone's talked to. We could build a public health system. We could build a testing scheme. We can get vaccines out. You can create shared sacrifice around manageable groups. The idea that you're going to do it with 375 million people all at the same time, especially in the midst of politics, no. But we could build a public health system which is somewhat isolated from politics, we can do these things. I didn't hear.
It requires us to do things differently than we do now.
All right. I'm going to just finally ask you a question about research, the cuts to research and funding. What is the state of play? This is something that your organization has been on the forefront of advocating for. Where are we?
I mean, look, Academy of Health is, entirely for the creation and production and use of evidence and data to improve health and healthcare for all. We want more and better research. I think that there are opportunities to reform our current system to make it better. We welcome anyone, including the federal government, coming to the table and, letting good ideas percolate and go around. I think that, some of the ideas that have been voiced might have merit. We're just not having, it feels like, that kind of productive conversation. And we're also looking at instead increased cuts. I will push back, as I did in the New York Times just a couple months ago, against those who claim that all the research dollars don't have benefit. It has massive benefit. We've seen unbelievable miracles in the last 5 decades. The world is so much better in a gazillion different ways, and maybe we don't do a good job of celebrating that enough. But I also can understand and can hold the other thought in my head that too many people feel like they don't have access to those miracles and that healthcare costs too much. And that also can be true, but those are separate things. And like the creation of great things and its access are not the same. And we have to be able to treat those things differently. We also have to be able to recognize that perhaps the system that we had before didn't work as well as we'd like. Maybe it didn't have as much solutions orientation as it pointed, just pointing out problems. Maybe it wasn't focused on the stuff that needs to meet the needs of most Americans. I'm willing to, accept lots of debate on all of those things. But we shouldn't just destroy the system that we have that has produced great things until we can, work on a new system, because in the interim, there's just not much going on. And that's a tragedy for everybody.
Dr. Aaron Carroll, Academy Health, always a pleasure. We are so grateful for your time today. Get back to your real job. Thanks to everybody watching live. Anything to plug? academyhealth.org. Anything else?
Look, Academy Health, always use your support. And we are out there, fighting for research and data and evidence. And, we are a whatever the nonprofit organization is. We are more than happy if people would like to support what we do. We are always happy to take that kind of support.
All right, take your professional hat off real quick. Reach behind you. Don't look which book you're grabbing. I'm guessing those are mostly graphic novels. Reach back without.
Tell me which one you want.
Just you. I guess you kind of know they're organized. So just grab whatever title. You can't read the title. Just grab one.
Right here.
Yeah, sure. Oh, you looked.
Oh, well, I pointed before I looked.
Move your hand to the left now, and now grab one. There you go. Grab that one. Now you looked.
Well, I have to look at the title. I'm sorry. I thought you wanted me to just tell you the title.
No, I want you to pull it off. I'm sorry.
Oh, that's a pain in the butt because I got to tilt it and get
just tell me that.
This is Stephen Donaldson, This Day All Gods Die. I believe that this is book 5 of the Gap Saga.
God, I love you. Thank you very much.
One of his lesser known. He's much more famous for Thomas Covenant, the Unbeliever, which is really good but dark too. But this is very good.
You should go live one day on YouTube or whatever and just go through your books and explain and give recommendations. That would be wonderful.
Oh, yeah,
so much fun stuff.
There's so many books here. I don't think
there he goes. There's a lot of Dr. Aaron Zoran.
It goes all the way around. It's big.
That's wonderful. That's so great. I've been in that room, and it's a real marvel. Stole some shit. All right, buddy. Thank you very much. Love you. Thank you for being here. Thanks for watching, everyone. Bye-bye.
Anytime.